Dear friends and colleagues, today I'm going to share with you one of my cases for replacing a missing central incisor. A male patient came to my office complaining of extraction of central incisor 4 months ago, and he needs to be replaced by implant. X-rays show that there is a bony defect at the site of the extraction, so the plan was implant placement and bony augmentation using LBRF and sticky bone. We prepare the sticky bone and the LBRF as usual. We had discussed this before. If you have any question about, you can return back to my previous videos or you can contact me directly for any question about. After proper anesthesia, we go for the incision because here the extraction of this incisor is recent. We still have good interdental papilla. So the plan was to keep the interdental papilla in place. We do not make a full reflection. So we maintain the interdental papilla for the mesial of both the upper right central incisor and the upper left lateral incisor. Because the patient still have some good bone quality, the plan was to make immediate implant loading. I prefer to make the immediate implant loading with provisional abutment and provisional crown. We then make the final crown 4 months after implant placement. After the proper osteotomy and using the surgical protocol of the implant is using, here we'll use the countersink to allow for a traumatic implant placement for the remaining bone. We make implant ready for implant placement. Here I'm using an implant is coming with uh, activation fluid. We start implant insertion, first with the handpiece, then for the ratchet to be sure that we have enough torquing and enough primary stability. To make sure that our implant is ready for immediate load, after using the torque, I use the torque in the reverse direction and check if the implant is moving or not. If we reached 25 Newton per centimeter torque and the implant still stable in place without any movement, so it means the implant is ready for immediate loading. Here I cover the implant with the healing abutment so that there is no need for re-entry, and apply the bone graft and membrane and suture. After 3 or 4 days, after the patient is recovered from the surgery and there is no bleeding, we can remove the cover screw or the healing abutment and insert the provisional abutment and insert a temporary crown. Membrane should be applied very carefully and suturing to maintain the interdental papilla and make a secure coverage for both the bone graft and membrane to allow for proper healing.